Hello, I've dealt with peripheral neuropathy for a very, very long time, for many years. Um, and I've actually been treating it as well for quite a while. And the idea is, what I find is that so many individuals are being distracted and often even deceived by the misinformation and even the misconceptions of peripheral neuropathy. So I'd like to go through a couple of those today. Hello, I'm Dr. Brandt Gibson, and one of my favorite things to do is to help individuals with peripheral neuropathy find solutions and get their life back. Basically, the truth is you should be able to live the exceptional life, the life you long for, even with peripheral neuropathy. And so that's kind of what we're looking at. That's kind of where we're going today, is to help you overcome some of these misconceptions and the misinformation that's being out there. So number one of the things that is a strong misconception or misinformation is that when you have peripheral neuropathy, the nerves are dead. The nerves are not dead. In most cases, it is a malfunction of the nerves. The nerves are not working like they're supposed to, but they're still working. They're just sending the information correctly. They're sending it too slow. They're sending it too weak. And so the information doesn't get to the end of the rows like it needs to. Number two misconception is that peripheral neuropathy only happens with diabetes. Well, the truth is, diabetes is one of the causes of peripheral neuropathy. It is a common cause in the United States. It's a common cause, truthfully, around the world, but it is not the only cause, nor is it the primary cause in some cases. Even though you have diabetes, it may not be the primary reason that you're having peripheral neuropathy, and there may be things, easy things that you can do to treat your peripheral neuropathy, even though you're still working on managing and controlling your diabetes. Number three, people are told constantly that there's nothing you can do for peripheral neuropathy, and this couldn't be farther from the truth. The science of peripheral neuropathy management is growing exponentially. It's growing so quickly. There is so much more information coming out. And there are so many treatments, so many options. The problem with this, the reason that most individuals struggle with this, is because there is no one treatment. There is no one thing that actually solves it for all individuals. Every individual's peripheral neuropathy is different. It's unique. And because of that, if a treatment doesn't work for everybody, they consider it a non-treatment, or they consider it not something that will work. Number four, once a nerve dies, once a nerve is damaged, it cannot be fixed. Now, this is similar to the one we just did. However, like I said, in number one, we actually says that it is not usually a death of the nerves. In some cases, in small fiber sensory peripheral neuropathy, there are nerves that disappear. If you do an epidermal nerve fiber density exam and you take a piece of the tissue and they count the nerves, there are less nerves than normal, which means you've got nerves that have died, nerves that are gone. But what we also have is studies showing that through nutritional improvement, through vitamin therapies, through some of the additional treatments that we actually can do for peripheral nerves, that these small fiber nerves regrow. They come back. You do an exam at 6 months later and the nerve count has gone back up, which means only one thing: the nerves are regrowing. They're coming back. Number five, all types, the misconception is all types of peripheral neuropathy are the same. That is not the case either, because what we're finding is, like I said, every single person that has peripheral neuropathy has their own unique form, their own unique type, and so forth. And so that's why it's imperative that you understand your peripheral neuropathy and understand how to treat this. And that brings us to number six. Number six is the fact that there is no doctor that's going to give you, that's going to treat you, I guess is the best way to say it. There's no doctor that's going to treat you and solve your peripheral neuropathy if you don't get involved. There is no magic bullet. There is nothing you can do one time and have it fix your problem. This is going to be a secret, and the secret to this is you. you need to be involved. As with all aspects of your health, if you say, okay, I am just going to depend on the doctor, depend on the medications for this to work, you are not going to get better. You are not going to improve. The only way that you will improve is if you get involved and you play an active role. The most effective treatment is the treatment that you're going to do consistently, that you're going to do every single day, and that you're going to be involved in. If you are involved, then truthfully, peripheral neuropathy can be treated. You can get your life back. You can live the life you want to live and enjoy your family, enjoy your hobbies, enjoy those things that you have always enjoyed. Well, I'm Dr. Brandt Gibson, and this is Neuropathy Nugget Day 369. There are misconceptions and misinformation about peripheral neuropathy that you need to understand. And through these misconceptions that I talked about, this misinformation that I talked about, you can find that there really are treatments. You really can reach your goals, live your dream, and enjoy an extraordinary life, even with peripheral neuropathy. If you're willing to take the steps, if you're willing to be involved, you can have your life back. Thank you.